With few exceptions, most people would prefer a nice white smile, and one of the simplest ways to get that is teeth whitening or bleaching. In today's video, I'm going to discuss the different options out there and help you understand the benefits and drawbacks of each system. Stick around. Hello again everyone, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the US. So teeth whitening has actually been around since the 1980s, and no big surprise, there have been tremendous advances since then in both the options available to you, the consumer, as well as the results achieved by these products. But bear in mind, there are circumstances where whitening is not recommended or will be less successful. Here are some examples. Number one, bleaching is not recommended in children under the age of 16 as their teeth are still developing and the whitening material can irritate the nerve of the tooth badly and cause the teeth to become very sensitive. Number two, teeth whitening is also not recommended in pregnant or lactating women because, well, come on, we really shouldn't be introducing any unnecessary drugs or chemicals to these women. Sorry, Mom. Number three, if you already have sensitive teeth and gums or have receding gums, it's best to talk to your dentist first before using any system out there. Number four, if you're a heavy smoker, a heavy coffee or tea drinker, or a lover of your red wine, you gotta know you're working against yourself here in trying to whiten your teeth. Number five, if your teeth are dark in color naturally, you need to understand that your results will be hampered. You're likely just to end up with slightly less dark teeth. Which leads me to the next point, and that is number six, have realistic expectations. If you're hoping for that super white color, like a sheet of white paper, let's say, then you may be disappointed with the results. And lastly, number seven, if your front teeth have any fillings or crowns or restorations of any kind, you need to know that none of these materials will whiten. You'll need to whiten your teeth first, then have all these restorations redone to match the new whiter color. But if you want to whiten your teeth again in the future, the whole process starts all over again. So definitely be aware of that rabbit hole before you even start. Okay, so assuming you made it past all of those restrictions, let's go over some of the more popular systems out there, from the simplest to the most advanced. We'll start with the whitening toothpastes. Truth be told, these toothpastes contain no bleaching agents whatsoever. Some may contain some gentle polishing or chemical agents, but all toothpastes simply rely on some type of mild abrasives to remove surface stain only. Expect to see very limited results, typically only one shade or color lighter. Moving on, we come to the whitening mouthwashes. Now, these products have gotten more popular recently. However, these are usually just your normal mouthwashes with an additional ingredient like hydrogen peroxide added that will whiten your teeth. You'll rinse with these mouthwashes for a couple of minutes twice a day before brushing your teeth, and that's it. That's not a really long time for these products to work on your teeth, although swishing for a solid 2 minutes will feel like an eternity, believe me. So expect to see results in as long as 4 months. You're going to have to be patient with this method. Most patients will combine the whitening mouthwashes with the toothpaste for an additional boost. Next up are the over-the-counter whitening strips. Crest White strips were probably the first to hit the market, if I recall correctly, but there are a number of players in this segment of the market nowadays, and these strips do contain bleaching agents of varying strengths. In my experience, getting these strips into place can be a little tricky, and talking with them in can cause them to shift around. So it's probably best to use these during some downtime, such as watching television or reading, something like that. Usually results are noticeable in a few days, with the full course of treatment typically completed in about 2 weeks. And you can expect your results to last about 4 months. We now come to probably the most common way to whiten your teeth, and that is the tray-based system, where you place the bleaching gel in a tray that resembles a mouthguard, pop it in your mouth, and wear it for a specific period of time. Again, there are several different systems out there. Some you wear during the day, some you wear overnight. Usually for up to 4 weeks, perhaps longer depending on the results you're going for. Personally, and from a professional standpoint, I would strongly recommend that you purchase your tray-based system from your dentist for one very important reason. Your dentist will make a custom-fitted tray that follows the contours of your teeth exactly. This will ensure that the bleaching material stays on your teeth and doesn't ooze over onto your gums. Most other tray-based systems rely on a pre-sized tray, such as small, medium, and large, and you pick the closest size for your mouth. Or a boil and bite method, where you heat up the plastic tray in hot water and then bite into the material, and there's your tray. Not custom at all. If the material does get on your gums, it can make them quite sore, and depending on the strength of the whitening material, can even burn your gums. So be very careful. And by all means, stop using these products if you start experiencing any pain or discomfort. Now, back when I was practicing, whitening kiosks in shopping malls were a thing. But now it's common to see whitening offered in beauty salons and spas. Please, do yourself a favor and avoid these locations, even if it's legal in the state where you live. Here are the reasons given directly from the American Dental Association. The overwhelming majority of these locations have no licensed dentists or hygienists on site, so don't be fooled by the white coats they may be wearing. The people providing this service do not have the professional knowledge or experience to pre-screen the patients for any pre-existing conditions, such as gum disease or sensitive teeth, or otherwise rule people out as bad candidates for the reasons I listed earlier in this video. Unlike a dentist's office, these locations are not regulated. They are dispensing strong chemical agents, and they are not trained or equipped to help you out if your gums start getting sensitive or worse, undergo chemical burns. This has been documented many times. And the reason they can operate as they do without being in violation of practicing dentistry without a license is because they never actually touch the customer. They hand you the trays and you place them in your mouth. In summary, please do yourself a favor and stick with a licensed dental professional for any whitening procedure. And lastly, we come to the in-office whitening, which is by far the quickest and safest way to whiten your teeth. Your dentist will give you a thorough exam to determine if you're a good candidate for bleaching your teeth, and they'll address any concerns first. They'll give you a professional cleaning to make sure you're starting out with a clean mouth. They'll protect your lips, gums, and tongue from the strong whitening agent so the gel only contacts your teeth. They'll be using the strongest bleaching agents available in a safe and supervised environment, and the results can be very dramatic, often a 6 to 8 shade improvement. Well, there you have it, folks. As you can see, there is a bunch of whitening options out there for you to choose from. There are differences in cost, differences in the time to see results, and the differences in safety. Talk to your dentist if you're thinking about whitening your teeth. Ask them if you're a good candidate. Let them know your budget and tell them how fast you would like results, and they'll be happy to guide you to the best system for you. Well, let's wrap up this video today. I hope you learned something that you didn't know before. If you like this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Please consider subscribing and be sure to hit the bell icon so you can be notified of future educational videos on dentistry made simple. Bye-bye.